The World Health Organization announced Monday that it has the approval to test the first malaria vaccine in the field in real-world settings next year. The organization made the announcement on the eve of World Malaria Day. More than 429,000 people lost their lives to mosquito-borne disease in 2015, and hundreds of millions become ill with a malaria infection every year. Some never fully recover. There has been tremendous progress in fighting the disease. From 2000 to 2015, there was a 62% reduction in malaria deaths, according to WHO, and a 21% reduction in the number of cases. There have been fewer deaths largely due to better mosquito control and disease awareness, as well as the sustained effort to get the right medication to the right populations, according to experts. But there are gaps in prevention coverage, particularly in regions such as sub-Saharan Africa, where about 43% of people at risk for the disease do not have access to protection against mosquitoes such as mosquito nets or insect repellent, according to the OMS. Africa is the continent that sees the largest number of malaria cases. The new vaccine will be tested in Kenya, Ghana and Malawi from 2018. The addition of a vaccine for the anti-disease mix could make a significant dent. This is great news. In fact, Dr. Fotini Sinis, an assistant director at the Hopkins Malaria Research Institute of Johns and professor Johns Hopkins University Bloomberg School of Public Health. It was formed with GSK scientists who did much of the original research to develop the news in its early days. At that time, no one thought that this would really be the job. Scientists are skeptical. But enormous success has been demonstrated. This is a vaccine that has the ability to make a real difference, Sinis. In Phase 3, 11,000 children were treated in sub-Saharan Africa, and mortality declined by almost 50%. That's thousands of lives saved. You cannot argue with that success. Sinis met with other malaria researchers to discuss the latest scientific advances in vaccine development. Due to the biological complexity of the malaria parasite, the development of a vaccine has been difficult.